five series of talks on anti-aging, and today we're going to talk about weight loss. It's one of the most important ones in my opinion. So what is anti-aging? Does it mean we're going to try to do things to prevent you from getting older? No, it's not. Anti-aging is not stopping you from getting older. It's things that we can do for prevention, for wellness. Hey, for wellness, to keep you in shape, kind of staying more in fit. It's preventative type stuff. But also, it's for looking younger. We all want to look younger, and I think that's a good thing to do. It's for your health, to improve your health, because that's what people want. They want to have good health, but they want to look good. They want to look younger too. I plan on living forever. That's what anti-aging is, right? And so far, so good, right? Well, it's a little bit more than that. Let's talk about the definition of what anti-aging really is. Anti-aging means that we're going to do things to decrease the degenerative processes that cause the appearance of older age, make you get older kind of prematurely. In other words, as we get older, our bodies go through a wear and tear type of a problem, a process that makes us have some medical problems that are not so good. And anti-aging concepts try to help slow those processes down so that you can maybe even reverse the processes that cause these premature aging. We're talking about degenerative processes of all kinds of areas on your body, the face, you're talking about your skin, your body, the distribution of your fat in your body. If you have too much fat, we're going to talk about that mostly today. Muscle tone, vitality, and your performance. Those are things that you can see. But what about things that you don't see? Things that happen inside of us, like degenerative processes of your brain, like Alzheimer's disease, like problems in the heart, cardiovascular disease, heart attacks. We all know about, there are things that you can do to prevent those types of things from happening. Problems with your blood vessels, your bones, muscles, of course the fat. You can reduce the fat by doing good dieting. And then maybe one of the most important things is, yeah, well, it's nice to live older, but we want to live with good quality of life. So those are all the keys. Because I believe that as you get older, it can be treated. The aging process can be helped out. And just like anything else in medicine, we kind of like to look at it as a disease. We want to treat it like a disease. In other words, we'll find out, well, what are your concerns? What are you concerned about? And then let's evaluate it. Let's see what the problem is. See if we can determine some sort of a problem that you might be having that as a diagnosis of the condition that you may have a concern about. And then let's formulate a plan to get this better, to kind of treat it, to correct any of your concerns if at all possible, and then let's implement the plan. Let's get the thing corrected, and then we have to have some sort of a maintenance plan in order to not only reverse the process, but keep it going, keep it reversed as much as possible. So, you think about it. You're thinking to your own minds, what are your concerns? Is it something to do with the face, your body? Is your weight? Do you have hormonal concerns? Or is it just that you want to have a little bit better health? What is your concern? Because our goal is to enhance your natural beauty, both on the inside and the outside, so that you have good health in both ways. And this is the first of a 5-part series that I'm going to be doing. Each one is about an hour discussion on a lot of different things. Today we're just going to talk about losing weight. Every month I'm going to be presenting these. The next one's going to be on the facial rejuvenation, next cosmetic procedures to help you look a little younger, and hormone vitality, because we all want to make sure we have good hormones. And then the last one is nutritional age. There are many theories of aging, and we want to talk about these theories. Talk about these theories of aging because it's very important. There are things that you can do to help the process. So in this series here today, we're going to talk about the problem that we have in the United States with the obesity epidemic. The medical problems that are from being overweight. We're going to talk about weight loss as an anti-aging action that you can do, and what are some of the contributing factors that are involved with gaining weight and being overweight. And let's talk about the things that you can do that works, the successful things, the actions that you can do that works to help you to get the weight off and keep it off. And we're going to talk about my diet programs. The True Diet is basically a summary of the programs that we offer. And also, when we do these diet programs, we always have to include lifestyle changes, because you can't keep on doing what you've been doing. You have to change. You have to change, and you have to change in multiple ways. We do have a problem in the United States. Obesity is a major problem in the United States. It's a rapidly growing problem. The Surgeon General has called it, being overweight, the biggest health concern in the United States. Over 64% of the adults in the United States are overweight. Over 34% of U.S. adults are considered actually obese. And that's increased over the last 25 years, almost 120%. Really high percent. And all this has to do with the fact that when you're overweight, that being overweight is directly linked to an increase in medical problems, morbidity and mortality that can occur. And the problem is we're teaching our kids to do the same thing. You know, the incidence of childhood obesity is growing very rapidly. And these are things that we need to change. So, just as a little review, BMI is an abbreviation for Body Mass Index. It's a calculation that they do with respect to the height of a person and the weight of the person. So you can see there's different people on the screen there, and a normal weight is right in the middle, way in the back, because there's not that many of them anymore. BMI less than 25, that's the ideal. Then you have overweight is over 25 to 30. Obese is considered 30, BMI 30 to 35. Moderately obese is 35 to 40, and then morbidly obese, a BMI over 40. And we can calculate that out as an individual person, but let's talk about the fact that we are getting overweight. America is getting overweight, and it's rising rapidly, and it's estimated by the year 2025. There'll be almost 50% of America would be considered obese. And things that we have to do about it. And here's the problem. The problem is Americans, we just don't eat right. We don't exercise enough. And, you know, a lot of us just don't know about wellness and staying in shape and doing the right things. We don't eat enough fruits and vegetables. Well, according to the U.S. CDC, there are a lot of people who just are not eating enough fruits and vegetables. And that is a problem. They don't eat enough. And we should be able to do that. We should be able to eat fruits and vegetables very easily. That is part of it. Well, it's a problem in the United States, but there's actually a worldwide increase in obesity going on. 40% of men and women in developing countries are starting to be overweight. And there's like 7% of the current world population is overweight. And in Europe, it's not too bad now. In Europe, there's only about 22% of women, 50% of men that are overweight. So, you know, if Michelangelo came to the United States, he might do a little different culture of the David. He might do a little different sculpture of the David. A little bit. So, when you're overweight, medical problems can happen. And we can go from the top to the bottom, from the head to the bottom. In other words, right off the bat, you can have an increase in strokes. Cataracts is increased if you're overweight. Then you've got the lungs, pulmonary problems, especially things like obstructive sleep apnea. Obstructive sleep apnea is very, very common, especially in the obese people. Coronary heart disease is increased, diabetes, dyslipidemia, in other words, increased in cholesterol, which can contribute to heart disease, and high blood pressure, hypertension. Those are all increased when you are overweight. The liver. The liver is your refining factory. It helps to clean your body of toxins. Well, one of the things that it can happen if you are overweight is that you can have fatty accumulations in the liver, and that can cause a lot of different problems too. So fatty liver is not a good thing to have. It can affect the gallbladder too, an increase in gallbladder disease. GI tract, not that many problems, but the liver and the gallbladder are a problem, but the pancreas can have problems. You have an increase in pancreatitis. There's all kinds of gynecological problems that can increase with being overweight, such as increase in abnormal bleeding, polycystic ovarian disease can happen, and infertility. If you're overweight, there's less chance of you getting pregnant. There's all kinds of cancers that can happen too. And we're going to talk a little bit more about those because I think it's very, very important for us to know about this. Arthritis is a problem. When you're overweight, the joints just don't want to hold you up as well. And so they become arthritic very easily, and that can be a major problem. Well, it's bad for your health to be overweight. So the American Cancer Society calculated it out. It's so bad that there's they say that a third of deaths in the United States are due to things that we do to ourselves. And one of those big things is being just way overweight. Another one is smoking, but there are other lifestyles, but a big one is obesity. As a matter of fact, if you really want to look at it, these are all things that we can do something about. It's not just about making you look prettier. Yeah, it's good for you, but it will reducing your weight can reduce the incidence of cancer, because obesity is now the leading cause of cancer. It used to be smoking, but now it's obesity, which is a major problem. About 1 in 22 new cases of cancer are due to excess weight in the United States. So let's talk about some of these a little bit more. Breast cancer, that's one of the cancers that almost all women fear, is breast cancer. And you can reduce your risk of quite significant. You know, women who gain more than 20 pounds from age 18 to midlife, they double their risk of developing breast cancer compared to those who don't. Pretty amazing. Risk of dying from breast cancer. You can save somewhere around 11,000 to 18,000 people. There's that many less deaths if only people would lose their weight and stay at a normal BMI. Then there's all kinds of other comorbidities. We talked about some of these, but I like this slide because it kind of tells you, well, what is my increased risk? So I'm overweight, and here's my BMI. What is my increased risk? Just to explain this slide to you, if you look at the number one part, arthritis is increased. But if you have a BMI, you see down the road of 1, that means a normal, regular risk. If your BMI is 25 to 30, that means you have a 1.56 times risk. And it goes on up. If your BMI is over 35, you have a 2.39 risk, which is pretty significant. And that's significant for every one of those. So the higher the BMI, the more the chance that you're going to get a medical problem or complication. As you can see, all these different ones, including heart disease, and then diabetes, gallstones, hypertension, and stroke. But the main one that I want you to see is diabetes. If your BMI is over 35, you have a 6 times greater risk of developing diabetes. And that's a very bad thing to have, because diabetes can cause all kinds of medical problems. And not only that, it causes an economic impact. Being overweight, you got more disability, you have decreased production, your absenteeism is higher, and the healthcare costs are higher too. There's huge costs, annual cost of obesity in the United States. Just managing the obesity costs in the United States is around $100 billion, $52 billion in direct healthcare costs, and these are 5.7 of all U.S. health expenditures. Pretty significant amount. Things that we could probably do to on our own to prevent and reverse. So the loss of productivity, because people are overweight, is around $3.9 billion a year. But here's a big one here. $33 billion are spent on weight loss every year. Well, that's good that we're doing this. We're all trying to lose weight, but there's a lot of money spent, and maybe we can do something about that to decrease it. It also decreases, obesity decreases your lifespan. A 20-year-old male with a BMI of over 45 can expect to live 13 years or less than a normal. And a woman, a BMI of over 45 can expect to live 8 years or less. Pretty significant amount, so you could decrease your life expectancy. As a matter of fact, prior to this time, it used to be that our lifespan was going up and up and up and up. But now, because we are having this trend in overweightness and obesity, the trend's going to go the other direction now. Now they're thinking that the life expectancy is not going to keep going up, because it's going to start going down, simply because of the fact that we're all getting way too big. So losing your weight is truly an anti-aging action. In other words, it's doing something to your body to try to decrease medical problems that can happen. So one thing's for sure, if you keep doing what you've been doing, you're going to keep getting the same results you've been getting. And therefore, we got to think about changing. Well, all of us have probably tried to lose some weight and get the weight off, but there are things that you need to do. And I think the biggest one is you got to get motivated. And there's a lot of ways that people get motivated, but I think the best way to get motivated is to lose the weight real quick. The quicker the weight loss, the more the motivation that you will get. So a lot of things that I did in my diet program was to try to create programs where you lose the weight rapidly and you get motivated about it. But at the same time, you got to instill lifestyle changes. You got to change what you're doing. Change your eating habits, change the way you exercise, and change the way you're doing things in your life that is against you. Now, there are certain contributing factors that increase the risk of you gaining weight. And we're going to talk about all these different factors because I think they're very important. It's not just calories in, calories out. It's not that simple. Now, the lifestyle changes, the motivation needs to happen, but you also need to create the new habits so that you keep doing the right things for the rest of your life. So our programs kind of correct all these things. We try to instill the right lifestyle changes so you can maintain it over a long period of time. Let's talk about some of the different contributing factors that contribute to being overweight. Now, there's a big long list, but let's take them each one at a time. Well, poor food choices. You know, we tend to eat the wrong types of foods. We tend to eat the foods that have high glucose, maybe even high fructose. We don't eat the right stuff. We have too many calorie snacks, greasy foods. We eat too much fried food. And we eat a lot of carbs too. A lot of people eat too many carbs. Yeah, just soda pop, you know, easy thing like that. Way too many carbs. And we don't eat the right kind of healthy foods. We don't eat enough fruits and vegetables. We talked about that a little bit before. And then we got this problem of eating too much. Our portion sizes are just way too big. And that's a problem. All these giga burgers and all that stuff, it's a problem. Well, another contributing factor is emotional eating. A lot of us, when we have stress going on in our life, our emotions kind of get the best of us. We go out and we eat too much. We kind of hide in the closet or whatever and eat the wrong stuff. That's a problem, and we need to be able to discuss that and control it. Because how we eat is how we live. If we live kind of messy with not the right thing, we're going to end up having too much weight on. So we need to respect our bodies. We need to say, you know, how I look, how I feel is going to be a reflection of what I eat. And that's very, very important. We have to accept our emotions. We're all going to have emotional eating in one way or another, but we have to learn to control them. And I think that's a very important thing. We all have to learn how to do that, and there's ways to do that. You know, we have to discuss this with other people. Like, you always complain that I don't know how to show my emotions. So I made these signs to show it, so I can show my emotions. Yeah, we need to learn and identify the problems that we have. Another contributing factor can be this, a wheat allergy or a sensitivity. Now, one of the things that I think is very interesting about wheat is that it has changed over the years. Prior to the 1950s, we had a type of a wheat, was einhorn wheat, and it had like 16 chromosomes to it, but it didn't really produce very much. And then they crossbred it with some grasses, and they had another type of wheat that had like twice the number of chromosomes, and then they crossbred it again. Why did they do that? Well, because we have this worldwide famine. There was a big concern. We're not going to be able to feed the world. We got to do something to increase the productivity of the wheat so that everybody is fed. So they crossbred it, and to the point that now we have a lot of gluten in the wheat, and it makes it have a bigger kernel. It tastes better. It's sticky. It cooks better. Toasts better. You know, that's gluten doing a lot of that. The problem is a lot of people have a gluten allergy. And gluten is a combination of two different compounds. One's called gliadin, and one's called glutenin. Well, glutenin kind of makes it the sticky stuff. But gliadin is kind of interesting. It sort of has an opioid activity. So when you keep on ingesting a lot of wheat, it tends to go to your brain and it catches onto those opioid receptors, and you like it. It gives you sort of a pleasurable experience. And you kind of get hooked on it. Well, that's called a food addiction. And a lot of people have this problem. Plus, all that stuff can cause an excessive inflammation, which is a problem. So, another thing is the lack of exercise. Lack of exercise, you got to exercise. It's key to any weight loss program. You got to do it. You increase your internal basal metabolic rate, so your body burns up the calories, your energy and the metabolism is put to a higher level. And one of the things that a lot of people don't realize is that when you exercise, you actually increase growth hormone. I'm sure you all have heard about people giving themselves little injections of growth hormone. But you don't really need to do that. All you need to do is exercise and you get about the same, 1 or 2 units a day. That's what they do when they inject. So you don't need that, you just need to exercise. Yeah, exercise has a lot of other good things, including improves the sensitivity to insulin, improving your lean muscle mass, and it also increases your memory. Because when you exercise, you get more blood to the brain, and it does make it healthier. So you get better memory, a lot of good things. The Framingham study is a very important study. It's a very famous study. It was one that talked about the fact that you could reduce, if you reduce your cholesterol in your body, you may live longer because you might have less heart disease. Well, one of the other things that the Framingham study said was that if you just expend 2,000 calories a week, you're going to add a couple more years onto your life, which is pretty important. So that equates to you just walk about an hour a day. You're going to maybe increase your life expectancy at least about two years, if not more. It's just kind of neat. Stress is a big one. It's a big contributing factor. A lot of people kind of stressed out. And this is a problem. A lot of them are stressed out because of job situation or personal situations. They feel like they're out of control. They're out of control. Now, here's the thing. You may not be able to control all the stress factors that come at you, but you think about this, you can control your response to them. That's very important. Excess stress, if chronically done, causes an increase in secretion of cortisol from your adrenals. And this can result in something called adrenal fatigue. And that can make you really tired. And you can have a problem with actually gaining weight just because you have adrenal fatigue. It depletes a lot of the hormones that we need in our body, some of them like DHEA and cortisol. And when that happens, a change in the metabolism occurs in the body, and what ends up is that the fat cells tend to want to store the food even more, and you get overweight more. So it's a problem. So we have to worry, we have to correct things like adrenal fatigue whenever we talk about losing weight. But, you know, that's just some of the hormones. There can be other hormonal imbalances, like lack of thyroid. Thyroid gland produces thyroid, which is hormone which causes a change in your metabolism. Thyroid hormone is very important to increase your metabolism and help you to get the weight off. Things like PMS may be hormonal related, insulin sensitivity, and in menopause or perimenopause, you can have a low estrogen level. And that can also contribute to not only increasing weight, but also the distribution of the fat in the body. All these things are important. Andropause is when the male goes through this change and he doesn't have enough testosterone. Well, it's similar to the woman in the sense that you get a loss of energy, fatigue, because women, they need a little testosterone too. But in a man, if he loses a lot of testosterone, he can get overweight very easily, his energy level is low. Of course, all that's related to hormones of testosterone. But women have a similar thing. They need testosterone too. So we have to make sure that the balance of hormones is correct in order to help you to get the weight off and keep it off. There's some other hormones like pregnenolone and DHEA, which are precursors to some of the other hormones in your body. And we want to make sure you have an adequate amount of those too. Because as you get older, these levels do decrease. And melatonin, believe it or not. Melatonin used to be thought to be just one of those hormones. Oh, I just take this so I can sleep a little bit. And sure, it does do that. But as we get older, the level of melatonin actually goes lower. And that can contribute to you being overweight and having a little hormonal imbalance. I'm going to talk a little bit more about these things when I do my 5th talk. And very important. Neurotransmitters. Now, neurotransmitters are those compounds in your brain that cause the excitation, and they cause the excitation of the nerves so that we can think, and they also do a lot of other stuff. If you don't have an adequate amount of these neurotransmitters, you're going to have some symptoms, like you won't be able to sleep so well. You may be depressed, you have a lot of stress or anxiety, that can be a problem. And these are things like a tryptophan. Tryptophan that can suppress your appetite. 5-HT decreases your cravings. GABA is necessary for sleep. But there's a whole bunch of other ones that basically you can have a decrease in neurotransmitters that help contribute to you being overweight. The nutrients, there's certain nutrients that contribute to it. If you don't have enough iodine, you're not going to make enough thyroid. And there's a bunch of amino acids that can contribute to it. And a lot of vitamins can contribute to you being overweight if you don't have the right vitamins. We use this in one of our programs because if we give you a bunch of these vitamins mixed with amino acids, it does some things to change your metabolism a little bit and help you to burn fat. And we're going to talk about that a little bit more. And one of the concepts of aging is inflammation. And obesity has been now thought to be, it's sort of an inflammatory response. As we get older, the level of inflammation in our bodies increases. And when that increases, some degenerative problems can happen. So we want to decrease the level of inflammation. Being overweight increases it. And it's actually been termed obesitis. I-T-I-S is always at the end of some sort of inflammatory name. And so they call this obesitis because it causes inflammation, which is not a good thing. Fat tissue does produce inflammatory compounds, especially in the visceral fat, the fat right in here. And these inflammatory type compounds can increase heart disease, do all kinds of bad stuff to increase cancer, and a bunch of other things that increase those degenerative processes, the opposite of what we want to take care of. Inadequate fiber contributes to it. You got to have an adequate amount of fiber. It's good for your GI health too, and gives you a feeling of fullness and helps you to be satiated. Soluble fiber also decreases blood sugar loads, and it also decreases your cholesterol. And what we have found is if you have an adequate amount of fiber in your diet, you have a decreased risk for colon cancer too, which is very, very important. And we talked about the food addictions with meat, for example, but there's a lot of other ones. And all of them seem to have this same thing, same idea. They are compounds that can produce sort of an opioid type of an effect in your body. They get up to your brain, give you kind of a pleasurable effect, and you kind of get hooked on these things. Well, sometimes you have to fight these things, but they include chocolate, cheese, sugar, and wheat, and probably some other ones, but those are the biggest ones. These types of things, when you do the kind of addicted to some of these, they can create those sensations of craving. I need sweet, I need chocolate or something. These are a problem, and if you do our diet program that we have, we try to get you off all those things so that you don't have this. As a matter of fact, our diet program kind of takes a lot of these things into consideration. And we have other things that will help out, but we have basically two main diet programs. One is using HCG, I call it the HCG True Diet, which is based on an old diet called HCG Diets, invented a long time ago. We'll talk about that. But I changed the program, the old one, I made it so that you have better foods, because it wasn't the right kind of combination of the good nutritious type of foods and not enough protein in there. So I changed it a little bit. But the other thing that the old diet didn't have was lifestyle changes. You got to instill those lifestyle changes so that you can not only lose the weight, lose it fast, but also keep it off for a long time. You got to have the lifestyle changes. You add on their exercise. The old program didn't have exercise. You got to put that into your system. And there's no reason why you can't exercise, and you'll have plenty of calories to do it. The calories come from your fat. And then the long-term maintenance concept was not in the old program. I added that onto that. True Trim for Life is a program that I created really for people who have lost a lot of weight, but they just can't get rid of those last 20, 10 pounds, something like that. It's a program that it uses appetite suppressants instead of HCG. It's got a very similar diet plan, similar, but we want to make sure that it stays nutritious, but it's a very low calorie. So we use the appetite suppressants so that you can do a low calorie. You lose the weight quite rapidly, and then as you go along, we increase your foods and we decrease the dose of the appetite suppressant. One more chair here. We also want to instill the lifestyle changes and do those better habits, instill those habits into your lifestyle, including exercise. But then you need a maintenance program. And these programs do have some sort of a maintenance program, which we'll talk about a little bit more.